I'm Ron Miller. I'm a victim's lawyer with Miller & Zoyce. Our law firm handles birth injury cases around the country. If your child has suffered a birth injury and forceps were used during the delivery process, it's fair for you as parents to ask whether the use of forceps or the misuse of forceps was the cause of your child's birth injury. Obstetrical forceps look like this. They're essentially tongs. One tong goes around the baby's head, the other goes around the mother's pelvis. And when the uterus is not contracting at a level to deliver the child on its own, some sort of mechanical device is often used to assist in delivering the child. And forceps have been used now for 500 years. And 500 years ago, they looked just like this. There hasn't been a lot of change in them, but they're still a very important weapon in the obstetrician's arsenal to deliver a child when there's a complication. The problem with forceps is that they're often misused, and when they're misused, they can lead to birth injuries. The other mechanical device that's used is a vacuum, and a vacuum is a suction on the child's head that facilitates the delivery process. So while the mother is contracting, the obstetrician is using the vacuum and pulling on the baby's head. Just like when the mother's contracting, the forceps are being used to push the baby along through the process, right, through the birth canal. The difference between, besides the obvious, right, the difference between the forceps and the vacuum is that the vacuum is very easy for the obstetrician to use. You put it on the baby's head and you sort of suction the baby out of the birth canal. In contrast, the forceps are a very skilled instrument for an obstetrician, which means they need to have high skill in using the forceps to be able to use them effectively and to be able to use them safely. And if they can't do that, that's where the real problems arise. And the problems that arise are typically one of two major areas. The first area is the forceps are not properly on the child's head. And the key there is to put the forceps on the child's, just near the child's cheekbone, not on the head or on the skull, because those areas are so vulnerable in a child of that age that too much pressure can cause extremely serious injury. And the injury that the child's going to experience typically will be a brain bleed. And a brain bleed is a very bad outcome in the delivery process, and it can lead to hypoxia, cerebral palsy, and other birth injuries. The second related problem you often see with forceps that lead to birth injury medical malpractice cases is the doctor is simply too rough with the forceps and causes injury to the baby or to the mother, which is also a possibility with the use of forceps. Usually this happens during concerns of hypoxia, where the child is not getting the oxygen that it needs, where there's some cause for concern on the fetal heart monitor, and the doctor rushes and wants to rush too quickly to pull the baby out and misuses the forceps. If you believe your child has suffered a birth injury from a medical mistake, call me. I'm Ron Miller. My phone number is 800-553-8082. I'll be happy to talk to you about your child and the options you have. Thank you.